I mean, we know there is no limit to a parent's love, right? This next guest is proof of just how far we will go for our children. We first spoke with Toronto couple Terry and Georgia Pirovolakis in 2019 when they were told their son, Michael, had a rare genetic disease with no known cure that could lead to paralysis. Terry and Georgia immediately began raising funds, commissioning scientists to create, like literally to create, this brand new gene therapy. 4 years after that diagnosis, Michael received the dose that could stop the progression of his condition, possibly reverse it. We are so happy to be joined by Michael's champion, advocate, father. Terry is in studio with us today. Wow. Just honestly, Terry, wow, what you guys have been able to do in this short amount of time.
It was crazy. It was a lot of work, but we were very fortunate to have an amazing community, an amazing bunch of scientists support us.
How's Michael?
He's okay. You know, he has a lot of drugs that were protecting him from the gene therapy. You know, his kidneys and his liver and everything else. So he's gained a lot of weight, but hopefully he's going to start losing it and start progressing.
Tell us about the journey from Michael's diagnosis to where you're sitting today.
Yeah, so Michael was diagnosed on April 2nd, 2019 with this terrible disease. And as we went down this journey, we had to do safety testing. We found a team in University of Texas. They created a proof of concept that showed that this gene therapy would work. We then worked with a company called Charles River in Quebec that did safety testing for Michael. And then we partnered with a group called the Columbus Children's Foundation and Virogen, who made Michael's drug in Spain. And then we partnered with Sick Kids that ended up dosing Michael. So we had to send the drug from Spain to Toronto with 100 pounds of dry ice over 4 days, being monitored the entire way. And the Sick Kids team did an amazing job of taking care of Michael from the very beginning, from the day he was diagnosed.
How did you know what to do?
It was really just a learning curve.
Yeah.
We had an amazing team of doctors and scientists and people guiding us along the journey. And basically said, you know, this step is needed. And we would just go out and learn what we need to do. And they guided us and we just continued on.
And once you had the drug in hand, and then there was that moment, because you were acting with the scientists, creating this drug from scratch.
Yeah.
And now comes the moment where you give it to your son. And there had to be sort of an emotional dance in your minds about, okay, now here's the moment.
It was very tough and it was very scary. We were kind of mixed because there's such amazing improvement in children that get gene therapy. But gene therapy isn't 100% safe. We're seeing a lot of things that happen with gene therapy. So we were very scared, but at the same time, you know, there is no other chance for Michael. This is the only therapy for him.
When you look at videos like this, tell us what's going on here.
Yeah, so my son, my middle son in the background is trying to coax Michael into walking. And this is just trying to keep him mobile so that he doesn't, you know, the paralysis doesn't kick in more.
When you think about the last couple of years, so over the 4 years, you raised $3 million, your team. You found the scientists, you talked about that. You have waded through the clinical trials, the government approvals. Sitting here today, are you able to exhale at all?
No, because we're not stopping. Right now we're working, last Thursday we got approval from the FDA, and now we're working on the clinical trial in Texas. So our goal is to treat 10 more kids. There's no stopping, we have to cure them all. There's no, you know, Michael was #1, we said we'd cure Michael. And now our goal is to cure every single last one of them.
Tell me about the people that have been reaching out to you around the world.
Yeah, so you know, we've been every week we usually get about 1 call a week from a family around the world wanting to save their child from a different disease. Last week we got 20. You know, different people from Norway, from Pakistan, from all over the world, you know, asking us how we did it so we can do it for their children. And we've actually been guiding about 30 families since the day one to get to where we're at right now. So we've been very busy helping other families as well, plus my day job. It's been really busy.
Oh, yeah, right, you have a day job.
I have a day job,
right,
yeah.
like there's that
which
whole
I'm
thing
going right
too.
after here, which is pretty incredible.
So what happens next? What happens next for Michael?
So now it's just really wait and see. We have to really, you know, push him through a lot of intense therapy, and really it's unknown. It's like building a rocket ship, landing on Mars. You kind of know what's going to happen, but you don't really know.
Right.
So basically, if the protein that we created, so the way it works is the gene creates protein that he's missing. Yeah. And now it's up to his body to determine, will it absorb the protein and change his life?
You have already done that. I mean, it's just incredible what you guys have all done in just such a short period of time. So we obviously appreciate the fact that you took time to be in studio with us today to give us an update on Michael.
Thank you very much for having me. And thanks to our incredible community in Canada and Toronto and and then definitely in East York that really stepped up and helped us save my son.
Terry, thank you.
Thank you.
All of our best and love to you and your family. Thank you.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.